episode of the Sex Plus Health podcast. I'm Fred Wyand with the American Sexual Health Association, ASHA. So this is the second installment of a two-part conversation with Dr. Ina Park, author of the recently published book, Strange Bedfellows, Adventures in the Science, History, and Surprising Secrets of STDs. She's an associate professor at the University of California, San Francisco School of Medicine. She consults with CDC's Division of STD Prevention, and she's the medical director of the California Prevention Training Center. So she knows what she's talking about, and she's our best pal in the world. So welcome back, Ina Park.
Thank you, Fred. I'm so happy to be here.
All right. So in part one, we focused on sexually transmitted infections. And in this episode, we'll delve into other areas, including genital infections that aren't sexually transmitted, but worthy of discussion, which of course is why you cover them in the book. And also the modern phenomenon that is pubic landscaping. I worked up a line about that. So just let me say, I'm itching to have that conversation with you.
Oh, you went there, Fred. Oh my.
Boom. All right. And to the book, you have a chapter on the vaginal microbiome, all the normal flora and microorganisms one finds naturally in a healthy vagina. So I want to ask you about vaginitis. That's sort of a catch-all phrase, right, for a variety of vaginal infections. Two of the more common of which are yeast infections and bacterial vaginosis, BV. We get a lot of questions about these. I mean, but just first the basics, what's happening to cause these infections?
Well, so it depends on, what you're dealing with. With a yeast infection, there are yeast that live in your there are yeast that live in the vagina normally. But when you get an overgrowth of that, then you end up with that, uncomfortable, itchy sort of feeling that people get. And then this sort of thick, white cottage cheesy kind of discharge. And that's, signifies an overgrowth of yeast. But when we're talking about bacterial vaginosis, again, there are lots of bacterial players that can just be present in the vagina normally. If some of them grow out of control and they overtake the normal species of bacteria that usually should predominate, then you end up in a situation where you can have increased discharge and odor, and that's what is, characterized with BV. It's hard for those two things to happen at the same time. I have seen it happen, but one of them actually raises the pH. The BV raises the pH of the vagina quite a bit, and yeast are usually happier at the lower pH that normally the vagina lives at.
So I mentioned that these are both common infections. Any idea of just how common? I mean, these are things that most women would expect to experience at some point, right?
Yes. I mean, well, especially with yeast infections, almost every woman experiences it at some point in their lifetime post puberty. But when we talk about BV, some studies have shown as many as 1 in 4 women have dealt with BV, and there are some folks for whom BV is a very difficult thing to get rid of. Lots of folks will have it, treat it once, and they're fine. But if the microbiome, which is all the different bacteria that reside within our vaginas, get really disturbed and out of whack, it can be hard to sort of get it back into its normal happy state.
Okay, and let me just take a quick moment to mention that not everyone who has a vagina is a woman, and not all women have vaginas.
Yes.
Okay, all right, there you go. So let's talk about symptoms for a second. It sounds like they can be confusing. I mean, how can we really accurately diagnose yeast and BV so we know what's going on?
That typically takes a diagnostic test. Sometimes I think folks that have had recurrent yeast infections, they really know their symptoms and they say, I've had this before, I've had it diagnosed, I'm going to go treat it over the counter, and that's completely fine. With BV, it typically takes either looking at the cells that come off of the vagina under a microscope, and you can see actually tons of bacteria on those cells and, make a pretty definitive diagnosis. Then, of course, there are also tests that are done where you can swab the discharge and they actually will tell you which types of bacteria are found and whether or not yeast is present. So there are 2 kinds of tests you can do, one under the microscope that can be done right there at the point of care, and then one that has to be sent off to the laboratory to tell you sort of what's going on.
And so once we have a diagnosis, let's talk a bit about treatment options. I know
Yeah.
especially with BV, there were some newer treatment options, I think even a single dose, right?
Yes. So, well, with BV, typically what we'd like to do is give people if we can, give people 7 days of treatment, because if they can tolerate it, it just gives you a better chance of actually recovering and getting your vagina back to a normal, happy state. And with yeast infection treatment, there are 1, 3, and 7 day options. So, it's sort of pick and choose what works for you type of thing when it comes to yeast infections. Most of those medications will cure yeast with about the same level of effectiveness.
Okay, so I want to ask you a bit about how the partner figures into all of this. And
Hmm.
the information, the way we talk about these infections can be confusing. Like I've seen references in some patient education materials that'll say, like BV, while it's not sexually transmitted, it may be related to sexual activity or something like that. And
Yep.
and people are like, what? And we usually get questions about this in the context of, has someone cheated on me? So first off, can we talk about the fact that maybe these infections can be linked to sexual activity, even though they're not sexually transmitted? How do you parse that so that you can wrap your brain around it?
Yeah. For some reason, people who have never had any kind of penetrative sex, either from a toy or fingers or a penis, um, don't typically tend to have the bacterial changes associated with BV. Like we don't see them very often in women pre-puberty either. So something about sexual activity, and we have hormonal changes as we mature as well. The interplay of those ends up changing the microbiome. And one thing we do know for people who are having, penis and vagina sex is that the penis has its own microbiome. And so one theory is that the microbiome or the bacteria living on the penis can get introduced into the vagina, and then the vagina can get sort of tipped over the edge with that introduction of bacteria. And of course, if there's semen in the picture, that raises the pH and can set up an environment where those bacteria can thrive. So it's not a sign, it can be a sign of the fact that someone may have had penetrative sex, but it's not a traditional STI like we think of with chlamydia and gonorrhea. It's just a change in the bacterial state with some bacteria that might already be there, but it's almost like an imbalance of the normal state of being.
Okay. And what does the partner need to do, if anything, any testing, treatment, anything for them to think about?
Oh, Fred, I wish we had more, for folks who are female bodied who are having sex with men, I wish we had more to do for male partners. They've tried putting alcohol on the penis. Ouch. They've tried, all kinds of washes. They've tried giving the male partner antibiotics. All of these things that have been tried so far, we really just don't have anything for folks who are having, penis and vagina sex to use on the male partner or the partner with the penis. So I'm out of options here, Fred, in terms of partner treatment. It's really unfortunately incumbent on the person who's dealing with the bacterial vaginosis to seek treatment. And I wish there was more we could do with partners.
Well, I think it's a value, just the way you explain the whole dynamic about it's not a classic STI, but it can be linked to sexual activity. That piece is helpful because I can tell you, we get calls and emails from both sides of the equation, the patient's diagnosed and their partner saying, WTF, where's this person been?
Right.
So that nugget, the way the eloquent, concise way you put it will help me. So completely intend to rip that off.
And Fred, and you know what I would also say is I think we lead with this does not mean your patient was, I'm sorry, this does not mean your partner was unfaithful to you.
Yeah.
Because that is the number one question in the front of everybody's mind is like, what does this mean? So it does not mean that your partner was unfaithful. One thing I will say though, is because we know people's microbiomes mix, right? Like the penis and the vagina for those who are having, male and females who are having sex, those microbiomes mix. So you can use barriers like condoms, either internal condoms where the woman places the, condom inside, or the traditional sort of external condom rolled on the penis. That can prevent, for folks who are getting recurrent BV, can help reduce the chance of recurrence. But again, for folks who've been partnered for a long time, it's hard to use condoms continuously. And I totally feel that.
Yeah. Okay. So I have a couple of questions, and as I'm looking at them, seem to kind of be an extension of one another. I was going to ask, give us some general do's and don'ts of good vaginal health, and then I see my follow up to that was going to be, what about marketing and products like douches and deodorants designed to keep one fresh and clean?
Oh,
Does
I'm
it
so happy you're asking this, Fred.
does a healthy vagina benefit at all from the type of maintenance? So, what are some do's and don'ts, and do we really need that daisy fresh feeling stuff?
Right. Oh my goodness. So I'm going to start with first female bodied people, and I'm going to talk about trans men as well. So for folks who identify as female, what your vagina, we say your vagina is a self-cleaning oven. That's what we say in our field, and it's true. You don't need to place anything inside of there. There's nothing special you need to do. It is self-cleaning. For trans men who are taking hormonal therapy, so they're taking testosterone, for the masculinizing characteristics, things may go haywire in the vagina because of the exposure to the new hormones. So you are not doing anything wrong. You know what I mean? If you are transitioning and you notice things starting to go awry when you start taking your testosterone, you're not doing anything wrong. And please don't be tempted to stick things in there. Your vagina is trying to equilibrate to this new sort of hormonal environment that it has. And so you may get tipped over into having BV. You may have to go and deal with that for the first time in your life, just at the time when you're trying to transition. But that is just something that you might have to expect, and just be aware of it, but don't, actually put anything in there to try to douche it out or cleanse it out. And then
Okay.
for folks who have a neo vagina, so like trans women, Fred, who've had surgery, for example,
Mhm.
that is the only time when that's not a self-cleaning organ. So you actually have to go in there, and your provider can
Good
tell you, but
point.
actually, yeah, those folks do need to clean it out themselves. So they will douche. But everybody else, when you go, go into your local drugstore and go look at the vaginal products aisle. So there will be wipes, there will be powders, sprays, douches, there will
Yes.
be, yeah, there will be, 5 dozen different products. And your friend, Dr. Ina Park, is here to tell you you don't need any of them. So your vagina might recover. You can probably, you can stick 6 products in your vagina. Your vagina might be completely fine with that and might recover, and have it be no worse for the wear. And then you just smell like peaches or roses or whatever you smell like. But if your vagina is vulnerable to chemicals or any change in state, if you throw something inside of there, you could actually tip yourself over into having BV. And then you're going to get into a cycle of having odor, and you're going to feel the need to mask it with another product. So,
Mm.
yeah, my general rule of thumb is if you read the ingredients and you say, I don't want to put this in my mouth, then don't put it in your vagina.
Uh, well said. So I hadn't thought about that. There could be kind of a domino effect if you use some of these products that may cause some problems that make you seek another product and that kind of thing.
Exactly, exactly. And I know there's an entire industry that, needs to sell their product, but I think, those of you out there, it's tempting because, I think as a society, we tell women, something's, you have an odor, it's not pleasant, you need to cover it up. But, the truth is that all women are supposed to smell like something. Now, if it does smell, fishy or unpleasant, yeah, that's a sign that you actually need to go see somebody. It's not a sign that you should take some perfume and put it in there and try to cover it up.
There you go. All right. You also have a chapter called Bushwhacked, where you talk about the anti-pubic hair revolution. I mean, what's going on? Why the sudden pivot to clearing the runway?
You know what, Fred? At some point after my residency training, all my patients decided that pubic hair was the enemy. And I don't know why that is. And I mean, I have thought about it. I've obviously researched a lot for it for the book. And what I've determined is that I think it's just like hemlines, like the mini skirt was like a really big thing in the 60s. And
Mhm.
hemlines go up and down. And it's the same thing here. Like hair goes in and out. And right now, I think out is what is in vogue. And I have been telling people for years, if you remove all of your hair, or if you shave, too quickly without, appropriate like lubrication or whatnot, like, shaving cream, you can cause damage to your skin. But not being one of these extreme groomers myself, I just didn't know whether or not, I mean, I was giving the advice, but I said, I'm going to actually go and do this. And I actually got a Brazilian in Brazil, which I write about in this book. And I am here to tell you, Fred, on a personal level, it really does a number on your skin. And if you are to remove your hair and then go out and have sex with someone new, there are lots of little tears and breaks in the skin that could make you more vulnerable to catching a viral STI like HPV or HSV, herpes simplex, which do go into the skin.
Mm. Beyond that rather gruesome sounding experience, I mean, does pubic hair actually have a function we need to keep intact?
Well, I mean, it does protect the skin, from friction, and so do we have to have it? I don't know if it's a have to kind of thing. I mean, obviously we evolved the growth of pubic hair there, and I think it might serve some protective purpose, but it doesn't mean you can't have a completely healthy sex life and be hairless. I'm just saying, some patients come in and they actually take it all off before they come to see me because, or if they didn't have time to take it all off, they apologize. And trust me, Fred, like your
Mm.
pubic hair is the least of my worries. That's number one as a clinician. So don't do it for me. But if you like the way it looks, I say, more power to you. What I will say from the researchers that actually do this work, who look at the link between pubic hair and STIs, their advice is if you think that you are going to, get together with somebody in the evening and maybe hook up or have sex, don't shave immediately before you're going to go, out with somebody new. Actually try to do your pubic hair removal at least 6 or 8 hours before to give your skin a chance to heal before you might expose it to viruses.
Yeah. When I was listening to you there, I was reminded in the first part of this conversation, when we were talking about STIs, we spent a good bit of time on shame and stigma and that kind of thing. And as I was listening to you go through all the veritable buffet option of cleaning products and people apologizing to you for having too much pubic hair, there's a lot of this aspect is driven by the same type of shame and stigma. We're marketing to people and telling them, you can't be, you're not good enough as you are. Your normal odors aren't good. Your normal appearance isn't good.
Right.
And I just see it just all kind of ties together.
It does. It absolutely does. And I think when we talk about STIs, we add that additional element into it of, not only this whole thing about odor and your body needs to be improved or whatever, but there's also this element of, oh my gosh, am I being punished for doing something wrong by getting an STI? And I mean, Fred, what you say is what I say to everybody now, since I've met you, which is having an STI just means you're a human being. And same thing for having some sort of vaginal odor is also means you're a human being. You know what I mean? We are meant to have odors. So, we have industries all around us who are telling us, we shouldn't smell like anything except for their product. But I'm here to
Right.
tell you it's not true.
There you go. Dr. Ina Park, author of the book Strange Bedfellows, Adventures in Science, History, and Surprising Secrets of STDs. Where can we find this book?
It is everywhere books are sold. So Barnes and Noble, Amazon, IndieBound, Books a Million, any bookshop.org, anywhere where you can buy books, it's there.
And we will link to your website is inapark.net.
Exactly. You can read advanced reviews of the book there from some of my favorite authors, as well as some other publications. And yes, you can go to my website, inapark.net, and purchase the book there as well.
All right, that link will be in the show notes. I have to tell you, these conversations I've had with you have been among the most fun I've had since we've been locked down for the last year. So thank you for taking time to talk with me, Ina Park. I appreciate that.
Oh, thanks, Fred.
All right. So check out our podcast page for part 1 of our conversation with Dr. Park and all the other episodes we have there. Thank you for taking a listen. We'll speak at you next time. And until then, this is Fredo with Asha. So long.